capacity. Now, remember last week we did not have our Dr. Marlon Mackay with us in studio because of the fact that he was out in Paris attending a very prominent AIDS conference. Doctor, firstly, good morning to you.
Good morning. Good morning, Claudia.
How are you doing this morning?
I can't hear a thing.
You can't? Let's help you out.
That's better. That's better. Paris was awesome.
Mm-hmm.
Expensive.
Oh, no.
I know. I was telling someone, I know my 15 times table.
Oh.
Give me any number, I can multiply it by 15.
15 by 4.
15 by 4, $60.
Yeah.
Very expensive. Geneva was even more expensive. Italy wasn't too bad.
Yeah.
But what a lovely experience. And it was a nice time for my family, my wife and kids. So we had a great time together.
Wonderful. Companions, if you are interested, do log on to YouTube to see us streaming the segment live. You can get us on Kofifi TV or Facebook if you'd like, simply on our Kofifi FM page, and you get to see what we look like in the morning, undefrosted, still very frozen, and we apologize for that visual. But we've got the doctor looking all fantastic as usual. And
Thank you.
Please do share with us, what was the aim of the conference? What was the outcome really?
Okay, so this is the actual conference was called the 9th International AIDS Society Conference on Clinical Science. So this is a very clinical conference compared to the World AIDS Conference that you have every second year. Last year it was in Durban. So this year is mainly doctors, researchers, scientists, clinicians that attend. But we were still about 8,000 people from all over the world, 140, 150 countries who attended. And this year was in Paris. 2 years ago it was in Vancouver. Next year is in Amsterdam. And so this is where all these clinicians and researchers come together and present all their latest studies and the data that is coming out of there, the results of the studies and how it's going to impact us treating patients on the ground. Okay, so this is very, very fresh stuff that's not yet available in a pharmacist, for instance.
Okay.
One of the main messages that came out, for instance, was U equals U. The letter U equals U, meaning undetectable equals untransmittable. Now, if you understand HIV, when you are positive, you have a certain amount of virus in your blood. When you go into treatment, that virus must then become undetectable. Okay. So you're still HIV positive, but the amount of virus that is in your blood, we cannot count. We cannot detect it. So it's called undetectable. That's a sign of treatment success.
Okay.
And when you have attained that level of success, that you are undetectable, you no longer are infectious. In other words, you cannot transmit the virus to somebody else.
Wow.
So undetectable equals untransmittable. And there's a host of data that has proven unequivocally that if you're undetectable, number one, we know that you're not going to die from HIV once you're on treatment. But now it's even more exciting that you are not going to transmit the virus. So undetectable equals untransmittable. This was one of the exciting things. And a new tagline. Another one is, interestingly, you heard about the South African, the baby or child now, who has attained remission or functional cure of HIV. So this baby was part of a study where within days of diagnosis, so this baby was diagnosed around about day 32 of life, was put onto antiretroviral treatment by day 63. And then was put onto treatment for 40 weeks. And the treatment was stopped. And that child has now been followed up for the last 8 to 9 years. And over the last 8 to 9 years, that virus is still undetectable.
Wow.
Off treatment.
So
that's another exciting thing.
Yeah.
We are saying that if we can start patients on treatment literally within hours or days of them becoming infected, not of diagnosis now, becoming infected, we probably can result in a smaller reservoir, the amount of virus that's in their body, small amount, and therefore attain some sort of functional cure, almost like remission that cancer patients go through, where they've had cancer, but the cancer is no longer active. And here they have HIV, they are still positive, but not requiring any treatment. Because if they are as healthy as someone who's HIV negative. Another one was the exciting data about long-acting injectables. Now, there's a lot of patients who hate pills. Hate the thought of taking a pill. Hate the thought of swallowing a pill. Hate the thought of being on pills. And so now we're developing molecules in the form of long-acting injectables, just like you can have your contraception in the form of injection, go every 3 months. so two in long-acting cabotegravir and rilpivirine in a long-acting format or formulation, given injections either monthly or bi-monthly, every second month, also showing very good results in maintaining an undetectable viral load. So those are some of the things that are quite exciting.
Very, very interesting.
Before we just go on to our topic for the day, Doc,
Yeah.
I just need to find this out quickly. You know, in terms of the attitude, especially from South African point of view, the attitude when it does comes to HIV,
Oh, the stigma.
the stigma, has it? Are you seeing a change in it, or are we still very much stuck in our ways of 20 years ago?
No, I think there's definitely a major shift.
Yeah.
In fact, we're probably even shifting to the other side where there's almost apathy now. You know, we're getting to sometimes I feel that there's a bit of AIDS fatigue. People are saying, not again. You know, don't come tell me. We know everything.
Sure.
The problem is that we still have a major issue with young girls becoming infected, and especially in rural KwaZulu-Natal, where between the age of 15 to 24, for a number of reasons, including the blesser phenomenon, these girls and this the highest rate of new infections in the world is happening in South Africa. So somehow we've done very well with getting messages across. We've done very well with education, but we are still failing somehow in our duty to get through to certain population groups and certain geographic areas in South Africa.
You know, I think this is so interesting, and we should have a topic one day on HIV and AIDS just as a whole, because I think there's so much to touch on. But just to touch on something else as well. Last week, Friday, we bumped into a study from a British disease experts, and what they came out with was saying that we don't actually need to complete our antibiotic courses anymore, because they find that it's actually proving unnecessary, and once you feel better, you can stop taking your treatment. There are some people, including the World Health Organization, who has come out and said they disagree with this. And I think another medical study as well, they said, no, we believe in finishing your course of antibiotics. And as our resident doctor, we had to get your opinion on this.
Yeah. So there's very good data to suggest that that you probably don't need to finish it. The problem is, what does feel better mean? Feel better for you may mean something different compared to feel better for me. You see, so you may take the pill for one antibiotic for one. Say you're on a 5-day course and you take it for one day, and you wake up tomorrow and say, "Oh, I feel a lot better." Therefore, according to the study, I don't need to take. So after one dose, you feel, okay, I feel better. Therefore, let me stop.
Okay.
Someone else may take it after 4 days or stop it after 3 days. So there's too much variability in terms of interpretation of feel better, and that is why, as a rule, we rather say complete the course. Complete the course, not complete the bottle. So complete the course means if the doctor said this is a 3-day course, you take it for 3 days, even if there's still some left over. You see the difference?
Yeah.
The other thing is when we study the antibiotics, when antibiotics are designed and researched and developed according to a specific disease, it is tested 1 day, 2 day, 3 day, and it is worked out that according to the chemical formulation, this one will work best. The best curative rate occurs when it is used, for instance, for 5 days. Okay? The problem is resistance. And this is why they are this drive rather to stop early, because patients, instead of taking for 5 days, may take for 3.5 days, may not complete it, may take it for longer, may take it irresponsibly instead of 3 times a day, only twice a day, or when they remember, sharing of antibiotics. And so there is a school of thought, let's hit hard, hit early, and get out quickly. And we can minimize the risk of resistance. But there's too much variability in interpretation. What really does feel better mean? So for now, I mean, I've done it, and I've heard many infectious diseases specialists. I've been to conferences and talks where they've said it's not a bad idea to tell the patient rather to take it until you feel better, minimum 3 days, and then stop it. We're kind of saying rather, just as a uniform message, finish the course. If it's for 5 days, finish it for 5. Complete it for 5 days and get rid of it. Don't keep it hanging around. Don't use it on somebody else. But all this is driven by the severe problem of antibiotic resistance. We only have a limited amount of antibiotics, and because of a lot of irresponsible prescribing, in other words, doctors giving it for viral infections, patients demanding it from pharmacists and doctors when it's not really necessary, we are getting into an era of superbugs, and we're getting into an era where our antibiotics are no longer working, no longer effective against certain bugs. And this is why this type of research is coming out to minimize this problem of antimicrobial or antibiotic resistance.
Sure. We had to get your opinion on that one.
Yeah, and but you know what, Doc? I'm glad you actually mentioned the irresponsible prescription of antibiotics. Because I mean, I've always just wondered, doctor-patient relationship, whatever. If I insist that you should administer or prescribe certain medication to me, because I feel that, hey, this is me. I know
my
that
medical aid is my money. I waited for 2 hours.
I paid
Give me
you
what I
and all
want.
those type of things. Is there some sort of governance in place, from a doctors association point of view that says that Dr. Marlon Mackay, if you irresponsibly administer or prescribe medicine, these are the punitive measures?
No, you see, that's the problem. You see, so a doctor will go on his gut feel. He goes according to his relationship with patients. In my personal view and my practice, if a patient insists on an antibiotic and there is no reason for an antibiotic,
Sure.
I say no. I'm very firm on that. I said, my conscience does not allow me.
Yeah.
You can go and find another doctor that will do that. But let me show you. I'll be reasonable. Let me show you why I don't want to.
Okay.
Antibiotics are for bacterial infection. You do not have any single sign of a bacterial infection. Here are the signs of a bacteria.
Sure.
Do you have it? Do you have this? No. Therefore, why would you want? And I'll prove to them, let me make you better without an antibiotic. Just give me one chance.
Sure.
You'll get better without an antibiotic. I'll even make you better without a cough mixture. How about that? And so you restore the confidence back into the patient.
Yeah.
And you show them this is why we don't want to. You see, and if you take your time to explain it like that, patients will understand.
Yeah.
But I do not accept anybody coming in and making demands. Only this antibiotic works, man. You must give me this one.
Yeah.
That's absolute nonsense, okay? And doctors have to be accountable in terms of willy-nilly prescribing antibiotics when they are not necessary. That needs to come to an end. And patients also need to come to the party and say, stop insisting. Just because it worked for me the last time, or because my auntie said this antibiotic sorted her things out so quickly, you have the same thing, therefore. No, it doesn't work like that. Okay, antibiotics are overrated, bottom line. And we need to first prove that there is a bacterial infection. Okay, you know what I also do to help mothers, especially with kids? I'll say, here's this prescription. This is what I want you to use now. If, say, within 48 hours or so, you're still battling and it looks like your child is getting worse, and the fever's higher, and it looks like a bacterial infection, here's a second prescription.
Sure.
Hold on to it, and I'll post-date it for the next 2 or 3 days. And if your child does get worse, then you can go to the chemist and get this. But I'm not giving it now. 99% of the time, those parents do not end up using that prescription because the medication that are prescribed initially does the job. But at least the parent feels better. Okay, I've got my backup. Here's my prescription for an antibiotic. And that tends to alleviate some of that anxiety around the use of antibiotics.
Okay. You know what? We did have a topic for today as usual, but with time, we only have like 8 minutes left for the doctor. Let's squeeze in some of your medical questions, companions. You can send them through to 071 425 9577. And again, just a reminder, we are streaming live this morning on YouTube, Kofifi TV, as well as Facebook. Do join in and look at us. Unfortunately.
Good morning, Doc. I had a ganglion cut out of the top hand side of my wrist 6 weeks ago, and I still can't bend my wrist down at all, but can bend it up.
Okay, so a ganglion is a little cyst, a bony cyst that sits on top. You see, patients have these knobs. They can move around. Okay, that's called a ganglion. And unfortunately, the only treatment modality for that is excision, to cut it out. Okay. And it does take 6 to 8 weeks. After at least 6 weeks, there should have been, by now, full recovery, minimal pain. But sometimes, we say diseases don't always read the textbooks and they don't follow the timelines. All right. But if you feel that it's not getting better, if you feel that it's just maybe still niggling and not as a positive result as you would have hoped, then rather just go back to your orthopedic specialist and let him have a look. Okay.
Good morning, Doc. I just need to know, whenever I sit too long or I get up in the morning, my feet are so sore for me to walk on. What can this be?
It can be plantar fasciitis, which is inflammation of the fascia, all the ligaments underneath the foot, or it could be a heel spur, calcaneal spur. Your big heel bone is called your calcaneus. And sometimes you can get a bony outgrowth like a thorn that grows underneath. So the moment you stand up and put pressure on the heel, you get this excruciating pain. Okay? Your doctor will be able to help you define which of the two it could be. Plantar fasciitis, which is soft tissue, and a calcaneal spur, which is bone, and that's visible on a plain X-ray. Okay, so it's one of those two things. If you're really bad luck, you have both.
Also, doctor, just on feet, remember there was a time when someone complained about painful toes, and they're not really sure where that comes from. What was your recommendation for that?
I can't remember, but probably to see a podiatrist, look at your shoes, the tight-fitting shoes, and the other type of pain that you can get on the toes is Morton's neuroma, which is a type of nerve problem of the toes.
Okay.
Okay. Athlete's foot can also give pain, but it's usually with the rash as well.
Okay.
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 But our shoes are the biggest problem, eh? Women, heels.
Yeah.
Feet were never designed to be squashed into small places and small spaces like that, and walk on those 8-inch heels.
But it looks nice, doctor.
It looks nice, but yeah, you'll cry. Bunions.
Morning, doctor. Doctor, please, can you explain to me what is stage 4 in cancer?
Okay, so let's start with stage 1. Stage 1. So say you have cancer of the breast, for instance, or the prostate. Stage 1 is where the cancer is localized to that organ. So the cancer is just in the breast, only, nowhere else. So that's the best stage to find the cancer and your best hope for a cure. Stage 4 then is the worst stage, the final stage, where it is now spread from the original organ, the breast, to distant parts of the body. It has, what the medical term is, it has metastasized, changed and spread. So it can go to bone, to liver, to your kidneys, to your blood, to your brain. Okay. And that's where the kidney is usually, it's inoperable. Remember, it's gone further, so you can't operate and take it out. And usually chemo and radium therapy are the only treatments available for that. Okay. So stage 1, localized. Stage 2 is usually localized plus just to regional lymph nodes, so the glands around there.
Yeah.
Stage 3 would be proximal organs, the organs nearest to that. And then stage 4 is distal spread to distant parts of the body.
Okay.
So it's a diffuse spread of your cancer. So that's when you say the body's riddled with cancer. Or they just open you up and they found it all over and there's nothing that they can do. Right? That's stage 4. And that's unfortunate, we usually say that's terminal, because there's not much more that we can do. Okay.
Good morning, doctor and team. My husband has a problem when he sits for too long and gets up, and then he has a terrible pain in his legs. I think we just touched on that one.
Yeah.
Okay. Where else? On that one, sorry, sitting for too long and everything else. Could that also be a lower back or back or
even a back
problem?
Yeah. So it's a sign of inflammation, especially when patients come in. Oh, doctor, my back is so sore, especially when I get up in the morning. If your back is fine at night and you go and sleep, and you get up in the morning, check your mattress as well. You know, if your back is very sore during your sleep, that's also very important, very significant. There's a lot of inflammation, and bone pain at night is always serious. Never disregard severe aching bone pain in your sleep that usually wakes you up. That is usually more serious than just normal, arthritis or mechanical type pain. And coming back to the issue of cancer, which is very, very important. People are scared of cancer. They say cancer is, there's no hope with cancer. There is always hope. It's about early detection. You want a cancer to be diagnosed in stage 1.
Yeah.
And the only way it can be is if you are going for regular checkups, if you are examining your breast, for instance, if you're going for mammogram, for instance, if you're having your prostate screened regularly, okay? And the moment you notice a change in your body, so you know how your body is, the moment something is different that you cannot explain, something is going on. Don't just write it off and say, I'm sure it'll get better, or maybe I'm just going through a phase, or maybe it's just stress. Something is going on. Get an explanation from your doctor as to why. So if you're losing weight and people are complimenting you, don't get happy. If you know you're still eating like a,
Yeah.
and sorry, with due respect to those types of animals, if you know that you are eating the way you always used to, yet you are losing weight, something is going on. Don't get happy. You're either diabetic or you have cancer.
Sure.
So those are the thought processes that need to go through our minds. If something is happening and we cannot explain, if you're bleeding, you can't explain it. And blood should not be coming out of any orifice. Something's going on. Get help.
Okay.
1 more minute we have left.
Yeah, well, I think those are all the queries for the doctor today. 0714259577. We have also posted it up on Twitter at Kofifi FM _972. Hashtag Medical Tuesdays Breakfast Buffet. But But I just need to end. The reason why I was asking about doctors administering pills and all of that. There's a doctor out in India who was shot in the head by a husband because this doctor refused to administer, or rather to prescribe painkillers for his husband, for his wife rather, who's in extreme pain. So 48-year-old man whooped out his gun, shot a doctor in the head, and there you go.
I better say yes to every patient.
Yeah.
I will no, but we have to stand our ground.
Yes,
Doctors will not just say no. Please understand. We're not just going to be nasty and say no. I mean, we need our patients. We need that income. But I think if a doctor takes the time to explain why, you can't just say no. Let me explain to you, but let me show you another way how to fix it. And I think that makes more sense for patients, and the understanding is there.
Yeah. Well, Doctor, it was really lovely to have you back in studio with us. We're glad you had a very fruitful trip, and we will see you next week, right?
Thank you. Can I just say something quickly?
Yes, please.
You know, we came back from Paris, and our family is mourning again. You know, a few months ago, Joshua, my nephew, was shot in the head.
Oh.
And this time, my wife's sister, Charlotte and Kenton, they've lost their son, Kevin, in a car accident. 19 years old on Friday.
Yes.
And he had massive brain trauma and unfortunately passed away Friday night. So
Oh, no.
just
our condolences.
our condolences to the family. It's my nephew. He was like a son to us, and please keep our family in prayer as we'll be burying Kevin over the weekend. Thank you very much.
Absolutely. We do sympathize with your loss, Dr. Marlon Mackay. Thank you once again for your time. All right. Thank you so much for viewing with us here live on YouTube and Facebook. And we're going to continue with the Agony Uncles when we come back. Kofifi FM 97.2. Do not go anywhere.
For contagious laughter. Empowering conversations.
Let's make this the